Hello, lovely viewers. Welcome to another episode of Medi Shack. This is Honore as usual, and today we want to look at the RAAS that we talked about last time, that the Renin-Angiotensin-Aldosterone System. Now, during the last episode, we saw the Renin-Angiotensin-Aldosterone System. What happened? And today we want to use it to refer to certain two drugs that we have in our hospital setting. That is the angiotensin converting enzyme inhibitors and the angiotensin II receptor blockers. Now, in the Renin-Angiotensin-Aldosterone System, we saw at one part that the angiotensin I is converted to what? Angiotensin II by the help of the angiotensin converting enzyme. I hope you could recollect. I repeat again. We saw that our angiotensin I is converted to angiotensin II by the help of the angiotensin converting enzyme. Now, the angiotensin II is a very powerful vasoconstrictor. Anytime angiotensin II is in place, it constricts the vessels. When it constricts the vessels, remember our blood pressure is given by what? Cardiac output times the total peripheral resistance. So when there is an increase in the resistance of the flow of blood due to a constriction, there will be an increase in the blood pressure as well. So this angiotensin II can cause a constriction, vasoconstriction, which will increase the total peripheral resistance, and thereby the patient's BP will increase. Now, so what do we usually do in the hospital setting when we see the patient's BP increasing? Now, we want to affect this RAAS system by giving the patient angiotensin converting enzyme inhibitor, which means that the drug is inhibiting the work of angiotensin converting enzyme. And what does the angiotensin converting enzyme do? Angiotensin converting enzyme, as we saw in the part 1, it converts the angiotensin I to angiotensin II. So when you give the patient angiotensin converting enzyme inhibitor, for example, like lisinopril, captopril, ramipril, the drug is an inhibitor of the angiotensin converting enzyme. So it will prevent the angiotensin I from changing to angiotensin II. It prevents angiotensin I changing to angiotensin II, which means that there will not be this vasoconstrictor again called angiotensin II. So when this vasoconstrictor that is called angiotensin II is not present again, what will happen? That means the resistance will now reduce because there is no constriction. So as the resistance reduces, that means the total peripheral reduces. Hence, the patient's blood pressure will also reduce as well. Now, though this is very helpful, lisinopril is very helpful, but in a lot of patients, you see that when we give them lisinopril, they experience what we call cough and angioedema. Cough and angioedema. Cough, the patient may cough, and angioedema. Some of them may have some swelling at some superficial swelling, maybe something with the leaves at the surface of the skin, even those swelling, and a lot of them may cough. And cough is the most common thing we always see when we give lisinopril, which is angiotensin converting enzyme inhibitor, to the patient. Now the question is, why do patients cough when put on lisinopril? Now what happens is that since you are blocking the angiotensin I converting to angiotensin II, you have blocked the pathway for conversion of angiotensin I to angiotensin II. There is accumulation of what we call bradykinin, or some people say bradykinin. So bradykinin. So accumulation of this bradykinin is the cause of the cough in the patient that are on lisinopril. So angiotensin I not changing into angiotensin II, there is accumulation of bradykinin because of the pathway for angiotensin I to change to angiotensin II has been blocked. And bradykinin causes the patient to cough and experience angioedema. Now, when we begin to see this cough, what do we do? Or what do the prescribers usually do? Now, what you have to do is, since the problem is from angiotensin converting enzyme inhibitor like lisinopril, what you do? You must stop that drug. You must stop it. But thank God there's another replacement, similar work. So you have to stop the lisinopril. So when you stop the lisinopril, that means now there will not be any block in the changing of 1 to 2. That means 1 to 2 can freely change. So angiotensin 1 can freely change to angiotensin 2. But we can give another drug. Look at the third part. We can give another drug called losartan. And what is losartan? Losartan is what? Losartan is angiotensin II receptor blocker. And what is the work of the losartan? The losartan will allow angiotensin 1 to convert to angiotensin 2 because its work is not on the angiotensin converting enzyme. So it will allow angiotensin 1 to change to angiotensin 2. Now, after allowing angiotensin 1 to change to angiotensin 2, that means there is no accumulation of bradykinin because the pathway is not blocked again. So there is no accumulation of bradykinin. So you see that the patient will not cough. But still the BP will drop. How will the BP drop in this way? Remember, angiotensin 2 is what? It's a vasoconstrictor. Is that not it? Now, this drug, losartan, is angiotensin II receptor blocker. So it is going to block the pathway. It's going to block the receptor, It's going to block the receptor for the angiotensin II receptor blocker. It will block the pathway for the angiotensin II to work as a vasoconstrictor. How we get it? I repeat again. Angiotensin II receptor blocker will allow angiotensin 1 to change to angiotensin 2. And there will not be any accumulation of bradykinin because it didn't block the path. But as soon as it has changed from angiotensin 1 to angiotensin 2, the drug called angiotensin II receptor blocker will block the receptor for angiotensin 2 to work as a vasoconstrictor. Meaning that what? This man calling himself a vasoconstrictor, constricting the vessel to increase the BP. He cannot do any work again because the receptor has been blocked. And hence the patient's blood pressure can still drop when we use the losartan. Likewise, the patient will not cough when we use losartan. Thank you so much for watching our video once again. Make sure you subscribe, you like, you share our videos on all platforms. Don't forget to watch our next episode. Thank you. Bye bye.